Hello, my name is Dr. Vincent Giampapa, and I've been involved in regenerative medicine for the last 2 decades. Today, I'd like to discuss with you a revolutionary treatment to help you age more optimally in both quality of your life and how you function as the years go by. You know, as we age, the number of our regenerative adult stem cells decreases in number as well as function once we arrive at the age of approximately 40 years old. The number of damaged or aging stem cells, called senescent cells, increases as we arrive at that same age, and these cells are now known to cause our healthy cells to age quicker. They also increase the level of inflammation throughout the body, which leads to most age-related diseases we experience as we grow older. The amount of DNA damage our cells accumulate is also directly related to increased stem cell and body cell aging, as well as the formation of these senescent cells. The niche, or the area where these stem cells live, becomes more toxic as we age, and this decreases stem cell function as well. Well, the anti-aging treatment offered by RMI and created by myself based on my latest research involves the following. Adult stem cells are collected by a process called apheresis, or a blood filtering process, with a simple, painless IV placement in each arm. This usually takes about 2 to 3 hours while the patient can watch TV or surf the web. This is only needed to be accomplished once in your life. Now, the adult stem cells that we collect contain hematopoietic stem cells, which are the basis of your immune function, endothelial progenitor stem cells, which help grow new blood vessels, and mesenchymal stem cells, which can form multiple tissue types like cartilage, fat, muscle, and even nerve tissue. The collection process we use only collects non-senescent cells, which is unique to RMI and which are the healthiest variety of cells we need for the future. Upon completion of the collection, the stem cells are transferred to a stem cell bank where they are cleaned and processed. They are then slowly placed into cryopreservation at minus 120 degrees centigrade until they are needed. At this temperature, the aging process in these regenerative cells is virtually at a standstill. In essence, your regenerative potential is frozen in time for decades. After the collection process, patients usually feel fine, but may have a little sense of being tired or achy for the following day, but nothing of any serious nature. Using a special test, RMI can tell when you need an infusion of your collected stem cells to keep the number of cells optimal for helping to maintain your organ function, your immune status, blood vessel growth, and youthful appearance in years to come. All patients are placed on a daily oral program, which has been proven in published studies to decrease DNA damage as well as decrease inflammation. This has all been accomplished in human clinical trials at a major university. Sleep quality and energy also are increased to a significant level for virtually all patients. The program includes the collection of the number of cells needed for multiple treatments. The fee also includes cryopreservation for the first year and continuous monitoring of the cells in a certified stem cell bank. You know, most people ask me, well, what's the ideal age for a stem cell collection? But there really are 2 key times for people to collect their adult stem cells. Firstly, young adult collection is the most ideal. At this time, the adult stem cells that we collect, usually between the age of 21 or up to 40, the function here of these cells contain minimal amounts of DNA damage, and it is usually the best levels of their life in the future, for the future. Collecting our children's stem cells at this age is the most valuable gift that can be given to our family members. They can also use these cells later in life as they age without the need for restoration in the future. This is what we call bioinsurance, insurance for maintaining your future health span and longevity. Now, in mature adults, the second time to collect stem cells in adults in this category is after age 40 or 50 years of age. At this time, adult stem cells have suffered damage due to their DNA, as well as loss in their functional numbers of healthy stem cells, and an increase in the number of their senescent cells. Patients in this group, older than 60 years, can use their collected non-senescent cells in the future and can opt to have their stem cells restored, that is, to a much more younger functional state. Restored cells are even more efficient than their original cells for regenerative purposes as someone ages. We recommend our patients return for a yearly infusion of their collected stem cells, as well as other blood tests to document DNA damage levels and inflammation. At this time, the oral program can be adjusted to maintain ideal levels of DNA damage and inflammation throughout the body. The fees for the infusion yearly may vary to a small degree based on the number and types of cells needed for each patient. This is a revolutionary new program not offered anywhere else in the world, and without a question, the best option to offer you both an extended period of health span, longevity, and optimal useful function. Thank you.